Let's turn the conversation now to our health spotlight, if we don't mind. We want to talk today about a pair of stories that can affect the health of kids here in Indiana. We're bringing Wish TV medical expert and former Surgeon General, Dr. Jerome Adams now. Doc, good to see you. Can you hear me, sir? There he is.
I can hear you. Good to be with you. And I got to tell you, you were talking about pain at the gas pump. I got chest pain the last time I had to fill up my gas tank. So
I think
got to make
have.
sure I take my cholesterol medication before I go.
No doubt about that, Dr. Adams. Hey, I want to start with that liver disease that's affecting kids worldwide. We're hearing about more deaths. Now, the World Health Organization, as you very well know, sir, says 170 cases in 11 countries, including the United States. So what are we learning about the disease and how it spreads?
Well, we're learning more by the minute. It's now up to 16 countries, 10 different U.S. states, and over 200 cases nationwide being investigated. We know that they're investigating reports of unusual situations where children are getting hepatitis. Hepatitis is an inflammation of the liver. You can see elevated liver enzymes. You can see yellowing of the skin and eyes. And 2 children in the United States have needed to receive liver transplants after these unusual cases. They're investigating them to figure out the cause. And the honest truth is right now we do not know the cause, but many of these cases have been associated with adenovirus. They followed up on these kids and found out that they've tested positive for antibodies for adenovirus, which is a virus that can cause the common cold or cause a kind of a stomach illness that many kids have, but it hasn't been associated with hepatitis in kids before. So a lot of the health officials out there are flummoxed.
Is there any sign, doctor, that this illness is connected to COVID-19?
That's a great question, and a question that I think is perfectly reasonable for people to ask. So far in the investigations, they have found no association whatsoever with these children having COVID previously. A lot of the speculation is because you recently heard the CDC say that up to 2/3 of kids have antibodies to COVID. So, there's a good chance that these kids have been exposed and may not have known it. But so far, no clear associations with COVID. And they certainly have checked to make sure there are no associations with vaccinations of COVID in these cases of hepatitis.
While I have you, Dr. Adams, and I thank you for taking some time as always, another big story that we're following here is a major policy announcement from the American Academy of Pediatrics to eliminate race-based medicine. And I know you saw this, but I want to put it up on the screen for our viewers. This is part of their statement. Race-based medicine has seen pervasively interwoven into the fabric of healthcare delivery in the United States for more than 400 years. Race is a historically derived social construct that has no place as a biological proxy. Now, when you hear the phrase race-based medicine, doctor, what does that mean?
Well, this is an important statement by the American Academy of Pediatrics. It's a little bit wonky, so let me break it down for people really quickly. Unfortunately, throughout the history of medicine, race has been used as a means to give differential care, and in far too many cases, in the majority of cases, negative care to people of color. For instance, it was speculated that because of their darker and thicker skin, that African Americans felt less pain. And so there are instances where African Americans were not given anesthesia for surgery, whereas other people were, based on this false belief about their race. And so this statement is saying that we need to work hard to figure out the real root causes about differences in the way people experience health and healthcare, and not just say it's all about their race, particularly when we're denying care. We've seen this happen with cardiovascular treatment. We've seen it happen with urologic treatment when we look at how we treat people who have urinary tract infections.
Yeah.
And so they're saying, let's look at these social determinants of health, things like transportation and housing and systemic racism, meaning that we treated people based on the way that they looked differently in the past. But let's not say that, hey, your race alone is a predictor of whether or not we should give you a particular treatment.
And we should point out, doctor, that a big part of your work right now is getting rid of inequities in medicine. And how does a statement like this by a major pediatricians group impact treatment for kids, in your opinion?
Well, I'm the director of Health Equity Initiative at Purdue, and health equity is all about giving people the tools that they need to be able to make healthy choices. It becomes easier to do that when we collect information about the array of risk factors that a person may experience. We don't assume because you're white, you're going to be better off, It may be that you're white and rural, and so that we need to look at that as a risk factor. Or it may be that it goes beyond you being black. It's about housing and the housing that you experience that's causing you to be sick. When we dig deeper into those risk factors and not just blame everything on race one way or the other, it actually makes it easier for us to address the root issues. Because I can't change the color of your skin, but I certainly can change a lot of those predictors, a lot of those risk factors you have for poor health.
Dr. Jerome Adams, always good to see you on a busy Wednesday afternoon. Thank you so much for taking some time, sir.
Absolutely. Great to be with you, Phil.
We'll talk soon. Thank you.